a child being born with other methods, and it gives it a cosmetic appeasing look. However, it was collapsed, is now replaced by a steel ball. Well, it's really not steel, but a metallic ball, titanium, that basically now articulates with the acetabulum. And basically that's the only way this person will be able to function. Sometimes that's a partial hip replacement. But osteoporosis, if we look at the normal bone, this is a normal mineralization of the bone. In an osteoporotic bone, we lose the mineralization. So we do not have, if it's a mineralization and a matrix that keeps the bone healthy, with osteoporosis, now the bone is lost its mineralization, the calcium deposits in it. So that bone, which was normally very nice and square, now is actually a compressed bone that results. Now we have increasing number of compression with the bone. What is going to happen? You're going to lose height. So we all get short as we develop osteoporosis. But not only that, look at the vertebral body and look at the vertebral disc. When the bones themselves, shrink, we get shorter. But when the bones themselves shrink, we develop an increased curvature of the spine. So we develop a kyphosis in which we have an abnormal curvature of the thoracolumbar, the thoracic spine, and also an increased curvature of the lumbar spine. Now look at this person and see the areas that are prone to develop. And these are the areas we test to see the bone density. You want to see what the calcium deposits of the bone. Knowing fully well and looking at this diagram here, very small however, that shows how a woman's bone strength changes as she ages. When we're young and premenopausal, up to the age of, let's say, 40, 45, this is where a strong bone is. That's where the hallmark of a strong bone. We have more than strong bone as we are premenopausal. As we approach menopause, that shrinks dramatically. Why? Because estrogen in itself, the hormone that we produce to have our regular periods, is helping the absorption of the calcium. Does exogenous calcium, meaning taking in calcium tablets, always help? It doesn't. What helps tremendously is exercise. What helps tremendously is lack of smoking. What helps tremendously is developing tremendous physical activity. Even things like just brisk walking 20 to 30 minutes 3 or 4 times a week prevents the bone loss due to the demineralization of the spinal column and also of the important bones of the hip itself. Just minimum amount of exercise, decrease our alcohol intake, discontinue smoking can do a tremendous help in terms of preventing osteoporosis. I will continue the discussion on osteoporosis. We'll continue our discussion on osteoporosis and why it's important for us to get our bone densitometry done, as well as getting our mammogram once we're over the age of 40. But also important for us to understand what are the risk factors of osteoporosis, what are the incidence of osteoporosis, how important it is to have our osteoporosis treated early o'clock, but more importantly is to try and prevent the disease. We cannot prevent osteoporosis because it's an aging process, but we can prevent the onset of the pathology associated with osteoporosis, meaning the increased curvature of the spine, the fractures involving the lower vertebrae, and the fracture of the head of the femur. In addition, both two are the most common sites affected. And also get an education in terms of what is a bone densitometry, why it's important to get a bone densitometry. And it's a simple test, it's painless, it's being on a machine that measures the bone densitometry, and to know what are the values that you're looking for and what are the interpretation of those values. Obviously, we can try and address these. It is going to be difficult to get them in one session, but this is the spine itself. This is the demineralization of the bone. These are the fractures that can occur because of the osteoporotic bone, and osteoporosis just means that basically we lost the mineralization of the bone. So instead of the bone having the trabecula and the strength it has in it, it's easy and fragile, as we all know from relatives of that we've had who've had osteoporosis and developed fractures. But who are the people who should be aware of osteoporosis? Here again, I'm just going to allude to this diagram. Why is it so important that the osteoporosis, the mineralization of the bone, is related to bone strength? It's a very simple concept. And postmenopausal, since it's much more common in women, obviously the postmenopausal woman after the age of 60, it's mandatory, in my opinion, that we should be tested for bone densitometry. for the mineralization of the bone. When we look and see what osteoporosis is, obviously this is a normal vertebrae with the bone itself and the disc in between. As the bone loses the mineralization, so it becomes smaller, and here it becomes more easily compressed. When it becomes compressed, you lose the curvature of it because it tends to be compressed more in the anterior aspect of it, and hence we develop at the age of 75 much more increased curvature, not as desirable as when we were even at the ages of 55. We look at the risk factors involving, especially more common in women, but also very common in men as well, is women are at a higher risk with osteoporosis, obviously with advancing age, also with a family history, definite increase in those who smoke and increased alcohol and those who drink heavily. Also, inactive lifestyle is a risk factor for it. People who never exercised before, but even with starting exercise at a later age in life, you can also increase the mineralization of the bone. But it's much more beneficial if you start exercising prior to your 30s. Also, those of us who have low calcium in our diet, just a cup of milk per day can help with that tremendously. Vitamin D deficiency caused by non-exposure to sunlight. Obviously, we have that in the Caribbean, but over here, our elderly parents should at least be exposed to sunlight and also have some form of physical activity in which they're able to move their limbs around, also increasing the mineralization of the bone, because when you exercise, it increases the trabeculization of the bone by the increased stress that you put on the bone itself. That's why exercise in itself, exposure to sunlight, when it's possible, should always be something that we look forward to. Definitely alluded to no alcohol, no smoking, because it increases the risk. Also, steroids themselves increases the demineralization of bone. Caucasians and Asians an increased risk as opposed to Afro-Caribbean population in the risk of having osteoporosis. Osteoporosis obviously can be treated or prevented, and the onset of symptoms prevented by early exercise, discontinue smoking, discontinue alcohol, increase our calcium intake in terms of food that's easily absorbable, but not trying to pump as much as vitamin D and Oscal and a lot of the things that I see commonly prescribed. A healthy lifestyle of increasing amount of exercise, sunlight, avoiding alcohol, not too many hours of sitting by ourselves in front of the TV, engage in early exercise at an early age, especially if there is a family history of osteoporosis, because here again it's a preventable disease. For most of us who develop it at a later age, for which they think that there's no treatment, biphosphonates will decrease the demineralization of bones and is shown to be helpful. What is it that we tend to look for? You put in a machine like this, in which actually sends a radiation through you. It really and truly, it basically just measures the bone density. And when you measure the bone mass itself, obviously any bone mass is normal. For any person who is not, remember the person who's had lost their ovaries either from an operation of total abdominal hysterectomy, bisalping, or oophorectomy, would also be at an increased risk of having osteoporosis. They should actually be on hormone replacement or estrogen replacement, which is something we should advocate with our physician in terms of prevention of osteoporosis as we age, but also in addition to the fact if we lose our ovaries. In addition to that, when we interpret the score, just suffice it to say any score less than 2.5, meaning 2.5 off the 2 standard deviation, meaning that you should be starting treatment as itself. In terms of the management of osteoporosis, it's to try and prevent our elderly from getting fractures, and also at the same time to not to take bone pains as being something that's benign, because you could be faced with a relative who's got a fracture, as I did a couple of weeks ago, who had an undisplaced fracture of the head of the femur. Fortunate for this woman, when she developed the avascular necrosis of the head of the femur itself, I had an index of suspicion this is what was happening, and she was referred to the hospital, had a hip replacement, a partial hip replacement, and she's now doing better, obviously vowing to exercise, discontinue her cigarette smoking, but she was not an alcoholic at the time. So osteoporosis in itself, now recognized very much so, very common in our society among the Asian population, and obviously preventable by just exercising, normal diet, and actually living a healthy lifestyle.